morning, guys. As a part of our results videos about hair transplant, today we made up a little different try, that is working on a person who has a curly hair. How do we do hair transplant in a person who have a curly hair? Kindly remember, not wavy hair, it's curly hair I'm talking about. But when we talk about curly hair, again, it's not like an African curly type. I think everyone must know the little difference between curly hair and wavy hair here. So we are talking about a curly hair kind of a patient today. Well, how do we handle such patients? What are the precautions we are supposed to take? What are the important points to be noted when we do a curly hair transplant? Kindly watch the video until end to understand what kind of scenarios we need to follow in the kind of a curly hair or hair transplant surgeries. Well, the basic difference between this curly hair and wavy hair is wavy hair will grow longer and it will give you a nice blending. Whereas curly hair, extreme curly hair doesn't grow long, and it grows long, but it curls. That's the reason after a certain amount of growth, it curls and still give you the way where sunlight will fall and you will see the scalp is visible. That's the reason it doesn't blend nicely. It doesn't camouflage nicely. That's the problem with the curly hair. Having said that, if you have a density more than 50-60%, it will give you better concealing and camouflage. But when we do transplantation, the density will be always less. That is the reason, even if you do one session with the curly hair, you still get to see the skin, and light can pass through the hair and you can get to see the skin. That gives you kind of appearance that still baldness is there. Well, these kind of patients, usually what we need to follow is, while doing the transplantation surgery, we need to implant more density. For that reason, we need to take a little higher placement of the hairline, or these kind of patients would always need second chest also. Well, this patient actually having a baldness of class 4 type, looks like class 4 roots type, where front and back we need to implant it. We have taken a little higher hairline to get more density in the front and back. When we planning the surgery, usually we do more density in the front and a little less in the back, because this patient already had some density in the crown. So that way we took higher hairline and we planned more density in the front and little manageable density in the crown area. After 8 months, if you can see, the density in the frontal area reasonably very good, but well, as I already told you, the density looks less, but in reality the density will be more than whatever you are seeing in the photos and videos, because that's the curly hair nature. And if you see the backside crown area, density is super excellent, because already certain amount of hairs were there, then we added more density there. So that's the better camouflage we achieved both front and back. So here the important point is taking the higher placement of the hairline to save the grafts because of the nature of the curly hair. And number 2, and probably a curly hair in certain cases it doesn't grow long, so we need to add more density to give you better camouflage. These are the ideas we had in our mind and to achieve this kind of density. So well, overall, because we are doing front and back, overall density is above average and it's very good. And if you can plan for only one area, especially front or back, you would get still better density. Well, this patient also can go for a second or future sessions in the future if you wanted. So these are the few points to be noted while handling with the curly hair nature. And well, these guys definitely can go with transplantation. And when we're talking about harvestation also, when you do the harvestation of curly hair, even root also will be curved in nature, so we need to be very careful while putting the angulations also, otherwise it'll grow like a erratic manner. These are the few points to be noted, and all went very well in this patient to achieve this kind of density. We and patient is very happy. I'm sure curly hair patients definitely can undergo transplantation, but kindly do have a personal consultation with your expert surgeon and take a decision, because of few limitations with the curly hair. Of course, the growth rate, growth wise, it doesn't matter. Only the way is going to be concealed for you the way it's going to be camouflaged for you should be little understanding before going for the procedure. And because of the curly hair, after growing a certain amount of length, it will get curls badly and still give you a way where sunlight can fall and you can see the scalp. Otherwise, there is no issue from the surgical side for the growth wise or other issues. And curly hair, actually, even the roots are very curly. So you need to have an expertise team to harvest it, because while harvesting, you should not get damaged. And while implanting also, it's not like a normal hair, because the curly hair has a different angulations in the roots itself. So we need to follow that. Otherwise, there is a possibility that you're going to end up in a failure transplant. These are the important points to be noted when you have a extreme curly hair. Well, do not confuse with wavy hair. Wavy hair, guys, has a nice blending capacity, has a good texture. So that's the reason we made this video, to understand basic details of a curly hair and how do we handle them. So kindly do consult your expert and take a decision to go with your transplantation if you have a curly hair. Thanks for watching. Thank you.